a vendor. They were very much steeped in lean. They did everything with lean processes. I have also experienced other organizations where we started and we literally just changed all of the benches to be the cell model and started tracking and doing lean processes along the way. So if you guys don't know all that jargon, you will, I'm sure, learn very soon. So I guess just my entire career has been with those philosophies and methodologies in my mind. So I worked many years for John Deere, and that actually was a very lean process as well. They're very high in quality. That was in parts distribution. And so you can imagine how you stock parts and how you pull them and pick them and package them and send them out to dealers in the whole, I was in the Northwest region at that time. So there were a lot of process flow improvement when I worked there.
Karri, I remember like one of my favorite videos, and I've kind of lost it and I haven't found it again. There was a John Deere like push-pull video where people were sort of play acting sort of the push-pull, and it was so much better than the one that we had from HP that I would show that to, my colleagues and friends and stuff. But you never ran across that video, did you, at John Deere?
It's likely that I did, but it was quite a few
No,
years
it's been years, right? So, okay.
We could probably find it though, I imagine, on the internet.
Yeah.
Then I decided to go into healthcare. And it was just, my mom was in healthcare and it was just a calling of mine, and went into quality improvement, and it was like, what is happening? We don't use business processes in healthcare. We don't do improvement. Like, what? Does nobody understand these processes? So I really resonated towards lean thinking and processes for a lot more clinical quality. And then I applied for this job, and just was the dream job for me that I wanted in my life. And it is on the team that is implementing lean at UC San Diego in the health system. And so we have a couple hospitals, a lot of specialties, and, for instance, a cardiac hospital, of our own. So what we do on our team is we teach yellow, green, black belt classes. So each of us needs to teach to keep our skills up and to interact with the organization and help people in our teams to get through the A3 process. We also do daily engagement system, which
so Karri, do you use A3 or DMAIC, or do you have sort of an A3 that has DMAIC in it, or how do you sort of handle that thing? It's always a challenge when you're kind of between that lean and Six Sigma world.
Well, and actually in healthcare, it's more of a PDSA.
Okay.
That is supported by, there's an organization called Magnet for nursing, and a lot of the really great, the Joint Commission, so our regulatory, it's really all about Plan, Do, Study, Act, so PDSA. So we take an A3 and we overlay PDSA onto it and show how it relates to PDSA.
Right.
I forgot to ask before we got started, but are you cool with this being recorded?
Sure. Oh yeah.
Okay, cool. Just wanted to make sure. That's super cool. I really liked that story. It sounds very close to mine, although I started in kind of non-traditional lean world in the energy sector, but still sounded very similar. So tell me about your current position. What do you do in support of bringing lean to the healthcare industry?
Yeah, so I am actually the lead for our daily engagement system. So you'll hear in lean, you'll hear that called daily management system, and it's rolling out. We're rolling out 5 tiers in our organization. So tier 1 is the staff level and having huddles and a certain format of a huddle in the morning to prepare readiness, alignment, and discuss improvement in 15 minutes, getting ready for the day. Are we ready to serve our patients? And if not, what do we need to do? What do we need to escalate? Can escalate all the way to the CEO before 11 a.m. every day if we need to get to that level. So since our organization has so many specialties, it's kind of, you can go to the clinics and the hospital and then you're like, oh, then there's this cardiac specialty that, oh, they want to do DES. And then transplant, oh, there's another, area that wants to do a DES. So luckily they're wanting to do our daily engagement, daily management system. And so really it's just teaching the concepts and being there to coach and support and make sure they're following the process. We try to support in the improvement section. People can submit ideas. And so we try to support everybody either doing an A3 or taking our training to learn how to do an A3 and just bringing forth that lean journey. So that's my main role in the organization. And there were 3 people doing it and now there's just 1, so.
Nice. Well, hey, you've leaned it up. No, I'm just joking. It's a terrible joke. Yeah, I mean, because that's really, you mentioned that term engagement, right? And that tends to be the real challenge when implementing these lean systems. Is it's either seen as this top-down kind of got to do thing, or this overly bureaucratic because we want to document everything, and so we've sterilized everything in our processes to not allow any sort of creativity, and so that you have that real lack of adoption. So what are some of the things that you have found most beneficial in engaging people in that problem solving on the daily level?
Yeah, I think the most powerful thing is when people see that their ideas or their problems can be elevated, escalated, and resolved. Because sometimes if they just continue to go to their manager with the same problem, they don't get anywhere. And so we actually have a little form that we use, and we put on a little poster for improvement, and it says, what is your idea for improvement, or how what is it you need to do, and how do you think it can be solved? And so it's not just complaining about the thing. It's like really putting on that improvement hat. How can we resolve this? And then we have people review all the ideas weekly. And I mean, for me personally, it's always that person that is just like, I don't care about this. Why are you giving me one other thing to do? Like, this has nothing to do with my workflow.
Yeah.
And coaching and getting in and digging, well, what is it about it that's bothering you? What do you think we're asking you to do? We really just respect, like, truly the respect in lean is for that frontline person. So being in Gemba and being to that frontline person and asking them, what is it we can do to help you, get your ideas through? So I always go and try and find that person that's a naysayer and try and figure out what's bothering you, or what do you need out of your workday in order to make this better. So I think that's the most.
So I just want to give the students a little sort of heads up. We're going to use Karri's statement there as a commercial, because we're going to talk about that Shingo principle, respect for people, in a little bit after we're done with our interview. So that's a great way to, everybody should remember what she just said, okay? Because I probably can't say it much better. So
definitely that. So are you at San Diego, are you following a particular model? Is there something that you have found especially helpful as from a principles-based approach, or what are some of the resources that you're actively using? Or are you just developing it kind of organically from within?
So we're really lucky. We actually do have somebody that worked for many years at Toyota production, in a Toyota production system in a plant. And so he has great depth of experience. And we have a couple other people that just have so much experience and just are wonderful coaches. So We do a lot of networking in the lean community. There are a number of different organizations that you can, and conferences that you can attend. So we do a lot of networking to try and, figure out how principles are working for people. But truly, UCSD Health is its own, as an academic medical center, it's got its own culture. I mean, you can't just come in and say, here are things that work, at Cleveland Clinic, let's try it. It doesn't work. So it's like, here are some principles. How is it going to work for us? So we're truly designing. We're about 2.5 years into our journey of lean at UCSD Health. And so we're very, very young in our journey, I'd say. And it's exciting to see, when COVID hit, our CEO was only huddling weekly at the tier 5, and they were like, well, it's okay, we get stuff done, we escalate, things work. They went to daily huddle immediately. Things were resolved immediately. Ever since they started doing daily huddles and using the lean principles and using our format, they have not stopped this entire time. And that's why the rest of the organization is interested in getting involved in daily engagement. And just to see it latch on like that and these principles be working, it's really exciting. I mean, it's sad that COVID had to hit in order for that to happen, but it really was, we were primed and prepped and ready for it to be integrated into the organization.
Well, I can tell you, as someone who's had to kind of lead those journeys or be a part of those kind of fundamental cultural transformations, that is a lot of really hard work. I don't I don't envy you currently, because I've been there, but it's also very rewarding work. And it sounds like you've really harnessed into that kind of top enabled all in approach, where it's not top down, it's not grassroots, it's kind of, we're all in this together. So that's super cool. I'd like to open it up to get students to be able to ask you a couple of questions, but I would, so if you have some for Karri, please, you can type them in the chat, or you can raise your hand and come off mute. If you type it in the chat, it'll make you come off mute anyways. So we'd like to open it up for questions for Karri for stand-up credit. This is the perfect time to pick someone's brain who is knee deep in this crazy lean world.
Yeah. So Karri, I love the passion that, that's coming through. So as our students queue up some questions in the chat, do you have like some like success story or even, a failure that, you learn from? Because, we learn from failures in lean just like we learn from successes, but is there something you could share?
Sure. One thing that comes to mind for me when you ask about that is we also do, we call them rapid process improvement workshops. I've heard them called Kaizen events or design events or rapid improvement events. I've heard it across the board. So we do a 5-day model. We prepare for it. We do our observations. We do our value stream maps, process mapping, and then we get everybody in the room for a week together. And so we did one on cardiovascular MRIs and scheduling for them. And it is really complicated because just the manner of cardiovascular and the different kind of MRIs. So we did a design and an implementation and went off and started doing the implementation plan. And some of the things that they implemented actually did work and reduce the time for an MRI for patients. But some of the things just didn't work at all. And so I think what they, it's a success story because they did reduce the wait time from 6 months for a wait time to go to about 3. But still waiting 3 months for an MRI is not great. So we were hoping to go to days. So, I mean, I think just there are constraints sometimes. You can't add FTE. You can't add another MRI. I mean, that's just the world we're living in healthcare. So we had all these great plans and, but we did have some success.
Well, and it also sort of speaks to, I think in so many situations when you walk into a process, like a lot of these students are, that if they've never thought about lean before, the people in the process never thought about it, it's really pretty easy to get a 50% improvement, which is what you did, right? Even just sort of asking questions and saying, okay, we can get it. Now it's still too long, but you've learned a lot and you're much better positioned for improving. Let's switch to the student questions. I get,
we talk about this for days, huh?
yeah, I know. I love this stuff.
All right, Griffin, you're up first, then we'll go to Roberto, and then we'll go to Maribel. So Griffin.
Yeah, I kind of put a little bit of it that I mentioned in the chat, but essentially one of my good friends goes to UCSD, and he was talking about like a long time ago over the summer, you guys' like plans to prevent against COVID and like test the campus people who like actually were on campus in order to prevent like a major outbreak at the school. And I was wondering if you were a part of that initiative of like planning a way to like effectively handle COVID on campus and test appropriately so that the students would be safe and could still return to campus to go to school or attend athletics and whatnot.
And maybe jumping on Griffin's question is, was lean thought of up front or is it an afterthought, right? So was there a lean piece of that?
So, I mean, I have good news and bad news. I was not part of that because I work for the health system side and it's completely different than the campus. So it's a hospital system. So that's the bad news, that I wasn't upfront on that. But my director actually was over a team on campus that called OSI. I don't remember what they're called, but they're basically the lean team on campus. And so there is a lean team on campus. And I do know that they were involved, but I don't have any details about that. They do very much act like consultants on campus for any major project that is needed to happen. With the health system, we're more integrated in with the executive directors and the leaders and the managers. And so we're more like part of the staff instead of a consultant coming in.
Cool. All right, Roberto.
Hi, Karri. So my question today was, since like your whole career and your first job, it seems like most of your life has been around like the lean methods. So I was curious if you just use the lean methods in your professional capacities, or if you use it like all around, if you just walk around and see different ways to implement it like around your house or your casual life too.
Well, I wish I was better at 5S on my house. I can always sort and shine, but I never sustain. So I definitely do use in the A3 model. So you want to look at what is your problem statement, current condition, target condition. People want to jump to countermeasures all the time. So, I mean, just people I interact with or at home, it's always about a countermeasure. And I always stop and say, where are we at and where do we need to be? So that's one thing I'd say that is definitely just part of who I am, because I grew up, I guess, in lean, and you just take a step back and use that thinking. What's our current? What's our target? Where's the gap before you start going to countermeasures? Because you can create quite a mess for somebody upstream or downstream, not just at work, but in I don't know, something you're volunteering in or at home or your wife or husband or kids.
That's a great question.
Yeah, and I know, like, Karri, it sounds like kind of like you, like one of the things I'm famous for is you get into a meeting with a bunch of people sitting around a table, and I go to that top box in the A3 is like, well, why are we here, right? Like, why is this important? Is this strategic, or is this like, are we in the weeds? And then go into this, like, what's the current state, what's the target state, and sort of move right through there. So if you can be sort of the sneaky one that drives the conversation, even if people don't know what lean is, sort of driving them through that sort of process, it can be very effective.
one of my colleagues is so good at that. He always comes in and says, what's the goal of this meeting? If there, you know, even if there is an agenda, he's like, what's our goal today?
Mhm.
Yeah.
Yeah, I always tell people, be really careful if you start dipping your toe in these lean waters, because you're going to start seeing waste everywhere and it's going to drive you bonkers.
Yeah.
Mary Bell, you're up.
Okay, that was like a pretty good segue because I was asking about sustainability aspects. I know that there is a good amount of waste within the medical field, but I feel like that waste is necessary because it's healthcare. But I was wondering, in your profession, is there anything that you've done to eliminate that waste in the medical field to make it a little bit more sustainable?
Yeah, for sure. I mean, there is a lot of waste. And sometimes when people say, well, you have to waste because it's healthcare and, you know, you have to.
Mhm.
If you just challenge that, I think. We had quite a few A3s from our students in pharmacy and other areas that were related to pharmacy. So pharmacy, you know, they get an order, they pick it, they put it on the shelf, hasn't been picked up in 5 days, they return it. So I mean, and then somebody comes in and they want that product, but they don't have it available to sell to them because it's on the shelf waiting for somebody that's not coming. So I would say always challenge that. So, I mean, one of the countermeasures of that is that they called to make sure the person's going to come in and pick up, you know, I mean, it's more, it does take time up front to make those phone calls, but then they calculated how much waste they were saving by not putting it out there and then returning it. And they actually found that it was less time. It seemed like, oh, we have to do all this up front, but when they calculated it all out, they actually found that it was saving. So, and I would say sustainability, UCSD Health is amazing at expecting sustainability. We do, for any of our big workshops, 30, 60, 90, 6-month, and 1-year report out. So they have to come and report out to a group full of people. It used to be in an auditorium, now it's on Zoom. Our executives are always there though. So it's that accountability piece. Also, our team comes and follows up, you know, well, how are you going to sustain that? And we ask people to build that into our A3. So we kind of look at that, and we do have a module on sustainability in our training. Great question. It's one of my passions is sustainability. How are you going to keep that going?
I appreciate that.
In 6 months.
It's one of Maribel's passions too. So, you know, maybe you guys can connect. So
Yes.
Am I cool with sharing your LinkedIn link page in here?
Please, yeah, please do. Also, my email address is my name, karribenjamin@gmail.com. So
Cool.
feel free to contact me.
Yep.
And then last question, Jessica, a hot dog is not a sandwich, Anderson.
Thank you for acknowledging our conversation. Hello.
Hi.
My question was kind of in targeting the more medical side of things. I know that especially in like the Los Angeles area, there's been like an increase in COVID-19 cases. And I was just kind of wondering if you had any insight as to whether like some of the major hospital players, you know, like Kaiser, John Muir, are working together at all in order to help kind of manage these outbreaks across the state?
Yeah, I mean, everybody's connected with their public health divisions and with the CDC. I mean, that really truly is who is driving a lot of it. There are, you know, actually before the holiday, our CEO had a town hall and said, I'm just really afraid of what's going to happen after the holiday because people keep gathering. So as far as COVID goes, there is a lot of collaboration and improvement work. And now there's a lot of focus on setting up vaccination superstations, which we have done, and we're getting 5,000 people through per day for vaccines. And even at that, the state and the county public health set the stages of how that's rolled out. So our team was in the design of the vaccination superstation in San Diego and on the ground, and like the operations designed it literally within 4 days. we were there on the ground with them, trying to look at improvement, doing a value stream map, looking at the flow, seeing how cars are flowing in and out, who's doing what, is there waste with medications or with running or with observations. So there could be probably better sharing of best practices on these vaccination superstations across. I know the UCs do share, so UCLA, UCSF, but everybody's just trying to get people vaccinated.
Thank you for that. Okay, so I think we probably, last question that we like to ask is, unless you got something you want to add, Eric. I don't know if you were, okay. All right, we're there. So, you have 92 malleable new minds that are going to be going out and leading the world. If you could impart one final piece of wisdom to them, like if you could just, give them like, if I knew nothing but this, I'd be great. What would you say to them?
I think that one thing that I am constantly asking people to do, and they resist for some reason, and then every time they come back and say, I wish I would have done this earlier. Go to Gemba to get your current state. Go out there, talk to those people, use that respect for those people, ask them what they see. Because it doesn't matter how good your standard work is. People will find workarounds if it doesn't work.
It's a good piece of wisdom. Good piece of wisdom. All right. Eric, do you have any other questions you want to ask?
Great, Karri. I just so good to have you join us. Thank you so much for taking the time to do this. And we try to get people like you to come in here to tell the students, they learn a lot in the online training and stuff, but having real people come in here, and it's a little bit of, we can't always go to Gimba, but we can bring a little bit of Gimba to the students. So thank you for doing that.
Well, thank you for, having real live people talk about lean. And I mean, I am super excited to see the field expanding and really catching a hold, and all you young minds, we need every one of you. So thank you guys.
All right, thanks.
Awesome.
Let's, so as a parting, can we get everybody to turn on their Zoom screens here a little bit, do a little Zoom wave for Karri? And Karri, if you can, if everybody can kind of go on, we can record this part of it, so people know. So pop on your screens, give Karri a wave goodbye, and then Wes, you want to take us into a 5-minute break?
Yeah, so it's 5:08 Apple time. So why don't we effort to be back at 5? We'll call it 5:14 just to round up, and we'll give you a little bit more than 5 minutes because Eric and I are generous, and that's just how we do. So we'll see you at 5:14.
5:14. Good deal.
Thank you.
Thank you, Karri.
All right. Bye.
Appreciate it.
Thank you.